Welcome, everybody. I'm Eric Nelson, HLC board member, and I will be filling in for Eliza today, although I do see John Lodiz is here. He is the vice chair of the HLC board as well. And we have a couple presentations for you today, and we're excited to get started and share those presentations with you. If you are joining and you want to introduce yourself, feel free to do that in the chat. Some updates for the Continuum of Care Board. As we had in the newsletter, we've been working on the strategic plan with Tenfold Health, and you can expect some outreach around the strategic plan as they continue to develop that. We are forming the PIT committee. This PIT committee is for the point in time count. That is going to be coming up in January of 26. And this historically is when we start recruiting folks for that planning so that we can be prepared when it comes time to actually execute the point in time count. There are community leads, as there was last year in each community. We're looking for a community lead for Redmond. This could be co-leads. To folks who are experienced with the point in time count, providing services to those folks in Redmond, and are willing and able, have the capacity to coordinate with multiple providers who would be counting folks during the week of the PIT count in January. We have announced in the newsletter that there is likely, we've heard from HUD, that there is likely to be some type of notice of funding opportunity for fiscal year 25. There are no details about this yet. As everyone probably is aware, the federal government is still shut down and does not have a continuing resolution to fund government operations beyond the essential ones that are being funded right now. So more to come on that. It will go out to the HLC newsletter mailing list. So if you already get the HLC newsletter, you will get an update on this, but that is one of the things that the board would update you on. There is going to be, oh, go ahead. If you have any updates for the newsletter, as we kind of say in all these meetings, please send your updates to Rosie, the info@cohomeless.org email. This can include job postings, program work, etc. Any content is good content for the newsletter, so long as it pertains to what the HLC does and its mission. The membership drive, we annually have a membership drive, and you can expect a notification to renew your membership if you are an existing HLC member. We should also say that annually we do try to do outreach to folks around membership to try to get folks who haven't been a member in a while or are perhaps never been a member of the HLC, a new organization. We have had some of those in the last year. We've had some new entities join the HLC, including OSU Cascades. And then there's going to be a work group that is formed. This is distinctly different than a committee of the HLC. This is to work on the governance charter. The governance charter is usually evaluated and proposed changes are proposed to the HLC general membership, all of you lovely people, annually. This governance charter work group would seek to try to develop recommendations around changes to the governance charter. If you are a current member of the HLC and you want to participate in this effort, please email info@cohomeless.org. Let Rosie know. Let somebody know that you want to participate in this effort. Alex, I see your hand is up.
Yeah, I was gonna ask, like, I've been coming to these, but I didn't know if I was technically like a member, and then I was gonna ask how that renewal or that recruitment works. Like, would you reach out to us to see if we're renewing or what?
Yeah, that's a great question. So Alex, and others that are, I don't see any others here, but others that are part of the Youth Advisory Board, the Youth Action Board. The YAB is a part of the HLC in its role as the YAB. So when youth are members of the YAB, members of that board, they are
Mm-hmm.
members of the HLC. They don't need to do anything special. They have a kind of a unique structure in the HLC compared to other organizations or individuals. So you don't
Okay.
need to do anything special, Alex, and none of the YAB board members do.
Thank you so much. I appreciate you answering that
Sure.
question. Really helped.
Good. And so that kind of, to expand upon that a little bit, if you are part of an organization and you're unsure of your organization's status, there's usually one person at your organization who is the point of contact for the HLC. That's who emails go to about membership, things like that. So you can expect that to happen if you're part of a shelter organization, for example, or maybe you are a part of a large organization with multiple offices. Best Care is a good example of this. Then there's usually somebody at your organization, and you should check with your organizational leadership to, if you do attend these meetings regularly, to kind of see who that is. You can also just email info@cohomeless.org and someone will respond to you and kind of fill you in on that. But never hurts to ask a question.
And just so that you all know, I did send out a batch of emails this week to organizations for renewal reminders, but those were just the ones who were up for renewal in September, October. So later in the month, I'll send out for those that are up for renewal in October. There was like a lot of renewals that happened kind of like September, October, November. So I'm just kind of gauging it around the time of when your renewal is up.
And I just want to say one more thing about the governance charter work group. If you've never worked on governance or charters or done anything like this before, but you are interested and you feel like, well, I don't really have anything to add, your presence is welcome in these situations. This is a great opportunity to learn from people who have done it, to ask questions, and to really kind of like jump in without any sort of obligation because it's a short duration kind of thing, doesn't have a big commitment. So it's a really good opportunity for people who are like interested but feel like maybe they don't have much to add. Any participation is good participation here, so long as we're all working towards the same goal of really digging into the charter and seeing what could be updated, what we could do better, things we could change. Thanks, Rosie. And without anything else, unless there are any questions before we get to our first presenter, John, do you have a question?
Yeah, actually, I just want to add a couple of things. So in this month's upcoming board meeting, we will be talking about the charter work. So this would be an excellent time between now and the 17th, if you have specific interest in doing that, to make your name known, either to Rosie or myself or to Eliza, so that we can add that to the discussion. And then the only other thing I wanted to add is on the strategic plan. We are expecting at least the board level or the executive board level to receive a current analysis from Tenfold in November. So it may be a little while, since we're probably not going to have a meeting in December and we're going to have the pit count in January. It may be a 2 or 3 months before we talk more about the strategic plan. We'll see. But there is work going on in the meantime. So we expect some stages to occur there. We recommended to Tenfold that during the holidays, since people are hard to reach, that they be at a place where they can do more internal work, more internal analysis, and then come back and report to us after that. So that's where that stands.
And we are sending out kind of monthly update blurbs in the newsletter on where we're at with the strategic plan. So if you're curious, that's a great place to check it out.
And without further ado, Shanika, Amy, and Alba, the floor is yours.
Thanks. Hey, Amy, let me know when you're ready. I will share my screen. Yeah, well, you can cue it up anytime you're ready. I'll do a quick introduction. My name is Amy Martin. I am with the OCHI team, which is over on the OHA side of doing things. We like to make everything an acronym. So just as we all do in social service work or community work, everything has to be an acronym. But as you see here, it's the Office of Community Health and Engagement. Up until about 6 months ago, we were known as CPOP, the Community Partner Outreach Program, but we became our own division in OHA, and so we're now the Office of Community Health and Engagement. And I am the regional coordinator here for the Central Oregon region. So I cover Crook, Deschutes, and Jefferson. And my focus is most specifically on those that are working with OHP members, people getting certified to become assisters for OHP and things like that. But also I am the regional person for kind of all things OHA. I don't want to say I know all things OHA, but I know how to connect to different people in OHA. That's kind of my skill set. So there's some contact information up there for me, but I'm super thrilled to be here, especially at this time. I don't know if y'all have heard, but Medicaid's been part of a discussion lately, and this is a difficult time in understanding how these effects are going to directly support, not just Medicaid and not just OHP, but the members of our Central Oregon community that are being served by OHP. So let's jump right in here with the federal government shutdown. So I've had a lot of questions since this has happened. But right now, the shutdown at the federal level has not affected anything at the state level in regards to OHP. So no changes. There's been no reduction in services. Members can continue to access how they have accessed historically across the state. There have been some clinics or smaller, medical providers or things like that who have tried to deny services to members based on their concern about getting reimbursed through OHA at the state level for OHP. But there are no concerns around that. And if anybody hears of that happening in our community, please let me know. It's something that I can address and make sure that everybody is receiving the messaging correctly, that there are no change in services for this shutdown. You're going to see an embedded link here for the webpage. This is an external facing OHA website that is constantly being updated. So old information is being removed, new information is coming in, all about our federal monitoring of changes at the federal level. So it's kind of a handy tool for you to bookmark, especially if you are working with people that are members of OHP or you are providers in some capacity, especially with those health-related social needs, things like that. This webpage is a good one for you to bookmark just to check in as things progress. We can go to the next slide, Shanika. So what does Office of Community Health and Engagement do? Our main work center, our main plans are all around OHP and OHP members, as well as OHP with renewals and changes and things like that. We do support a vast statewide and diverse network. On this slide, it says 1,800 partners, but I like to call it, those are community partners. So one thing that we do that not everybody in our community is aware of is that anybody can become a community partner with OHA and to assist members in the actual one system. So the one system is the eligibility system used at ODHS, which my friend Shanika is going to talk about the ODHS side of all these things in just a minute. But community partners have access to the one system for medical benefits, which means if you are interested in becoming a community partner, having a staff member trained as an OHP assister, I'm your first point of contact, and then I'll send you on to our team to get you organized with that. Why I want to highlight that is we know in HR1 there is going to be changes to Medicaid. It's not if they're going to happen, it's when they happen. And what those changes are going to look like is at a federal level, there have been changes that are going to reduce the amount of members that we are going to have that are going to be able to be on OHP. Now, are they doing that in a blatant way that assumes federal responsibility for that? They're a little more circumvent, right? So some of the changes that we're about to experience, most likely towards the very end of 2026 and the beginning of 2027, but these are going to happen. It's not if they happen, they are going to happen. Is that renewals for OHP are going to increase from right now. We have 2 years renewal for folks on OHP Plus, which is the one that we kind of all refer to as OHP. And then there's a 1-year renewal for a program called OHP Bridge. And then, of course, we also have Healthier Oregon for those that have different immigration or residential status. We have those as well. So by reducing our renewals from like 1 year and 2 years to every 6 months, we are automatically, that is a policy that is meant to drop people from OHP. Anybody that's experienced that renewal process with OHP, we have tried to streamline, and hopefully it's much easier than it was years ago. But you have to follow it. You have to know when you're up for renewal. You have to get documents turned in. If you are a community partner with OHA and you do have a certified assister on staff, and the more people we can get to join that network, the more touch points we have for everybody in our community to keep them from falling through the cracks and to keep them from losing OHP benefits. Okay. Even if you are an organization that says, well, we don't have the capacity to process OHP applications, we don't want to do that, you can still become a community partner and have a certified assister on staff. There is no cost to do it. We do all of the training and the onboarding for that. But those folks have access to people's medical information in regards to their OHP information. And you also have access to all of the letters and reminders that have been sent to those members. So at all of our different touch points, as we work with people throughout our communities, this is what we can do to help that attrition rate of folks that are going to fall off OHP because of that 6 month renewal. So it's going to happen. It's a bummer, but it's coming. And so one of my roles is to try to get as many people in our community as I can to reach out to want to partner with us. And so anybody that's here today, if you have an organization or you work for a nonprofit or anybody, you can be a volunteer. It's going to help us with that process. We also are going to be looking at work requirements coming down the line for OHP, but honestly, we have received zero information on how that's going to look, what that process is going to be, what kind of documentation, any of that. So I'm not going to even speak about that part now, but we do know that it's coming. And so anybody, please reach out to me if you're interested in being a community partner. It truly is going to help us saving people their healthcare benefits keeping people remaining healthy. Our most vulnerable, of course, are going to be falling through the cracks. And so it's just an important piece of work that we can all do to make sure that we're protecting as many people in our community as we can. Shanika, you want to go to the next slide? This is the OHA Federal Response Resources. So again, there's that webpage embedded link. If you're interested in keeping up on that, I highly recommend it. It's always a great resource of information. There's been a lot of information also recently about vaccines and access to vaccines. Just want to make sure that everybody knows that you do not have to have a prescription for your vaccines, as was initially stated, which led to a lot of confusing information and language being shared. You can go into your doctor's offices, you can go into your pharmacies, Safeway, Costco, wherever you see those signs, get your free vaccines here, or whatever that is. You are eligible to get those without a prescription. And if you want more information about that, there's an embedded link there too that specifically addresses the information about vaccines and access to vaccines. So I think, Shanika, that's my last slide, and I'll give one more push for anybody that wants to join and get more information about becoming a community partner. I would love to chat with you about it. If you have any questions, I'm happy to answer those, but do really want some for you to consider, because it is going to be a way that we can keep our community members healthy once the 6-month renewal is going to go into effect. So thanks for letting me come chat about that.
Thanks, Amy. I appreciate you chatting. Okay, so I do realize my subtitles are still on my slide because I am very cautious of making sure folks can hear what they're seeing. I cannot figure out how to turn it off at this current moment. I turned it on for another meeting, and now I think I'm stuck with it. So y'all are going to deal with it like I am. All right, so moving in, we're going to move on to ODHS. Let's see if it works. All right. So Oregon Department of Human Services. Hey y'all. I'm Shanika. I am your community partnership coordinator with District 10. That's my contact information. I also have with me today Alba Santos. She is our Oregon Eligibility Partnership Supervisor here at the Bend office. So I brought her with me today to kind of also help with the kind of questions that I know you guys are going to have. There's a lot of changes coming. And I will do my best to answer all and give all, but let's dive into some of those changes. All right, federal changes. There's stuff happening. Like Amy mentioned, they're coming quick and they're coming fast. Starting October 1st, so literally 6 days ago, work requirements have resumed. So that is the able-bodied adults without dependents. It has resumed for these counties first, so Benton, Clackamas, Hood River, Multnomah, Yamhill, and Washington County. That means folks are going to be required to either work or do volunteer hours. And that is how they're going to be able to maintain those SNAP benefits. Alba, am I missing anything on that? Because I know we were talking about this earlier because there was so much changes coming.
Yeah, so those are the time limits within the SNAP program where we're going to see a 3-month eligibility if they are found ABOD mandatory, and they would have to participate or engage in some type of work requirements to continue being eligible to receive SNAP benefits. If they don't, then they're limited to 3 months of SNAP benefits in a 3-year period.
Thank you for that. Because I know we were talking about it this morning. There's so many changes. I know you mentioned for Central Oregon, these changes have not gone into place yet, but that is coming up soon.
Yeah, so For the counties listed on the screen, they have to go through, when they're meeting with individuals that are applying for SNAP benefits, they'll go through a list of exemptions to determine if they meet any of these exemptions, so they don't have to engage in the work requirements or are impacted by the time limits for SNAP benefits. We were originally told that for Central Oregon and the rest of the state, we wouldn't have to transition into the ABOD requirements until January. I did find out this morning that that is going to be moved up a little bit, and we'll see ABOD coming statewide to all of our offices and all of our areas within the next 60 to 90 days. They have not shared with us when that's going to take effect. Our OEP leadership just heard about this on Friday, and they shared it this morning during one of our huddles. And so within the next couple of weeks, we'll see that official deadline for the rest of the state to go into those transitions. The one big change also with ABOD and the exemptions is they removed 3 exemptions that we had to ABOD and meeting the ABOD requirements. So one of those exemptions that was removed was being homeless or houseless, being a former foster care individual, and then also a veteran. So those exemptions were not able to apply to the cases. We do have another list of exemptions, and our workers are trying to go through each one of them and make sure that they capture all of the exemptions that they meet, so they're not subject to the time limits. But we did lose 3 of the exemptions that we had previously really relied on and had been able to exempt people from the work requirements.
Thanks, Alba. It's so much. Yes, that was, yeah, you summed up the slide. If you have questions, I can't see the chat, so if there's questions, please just come off mic so we can answer them and whatnot. Up next, what you should know, people should continue to apply for benefits. They should continue to, if they're eligible for it, continue to come on in. If changes are needing to be made, folks will be notified. That's why we want to make sure folks have updated contact information, whether that's phone number, email, mailing address, PO box. We want to make sure folks get the timely notices. Just like Amy mentioned, as well on our federal website, during the federal shutdown, ODHS will remain open and providing services and benefits as we normally do. So nothing has changed on that front. And then I want to make sure we all know about how to communicate, because changes, like Alba mentioned, one thing we learned last week changed completely, and now things are different today. So ways to get updates. If you scan this lovely QR code, it will actually take you to oregon.gov/news/federal updates. So that way you can always have those updates ready at hand. There's also a weekly podcast that's available on Apple Podcasts and Spotify. This podcast goes over federal updates that are happening and how it's affecting staff members as well as community partners as well. So that way folks know about it. You might hear a familiar voice, but let me know if you take a listen. More ways to contact clients. We always want to make sure clientele have ways to reach out. Online, in person, the one app, over the phone. If folks are going to call, there's a tip there of if you call between 7 and 8, it has the lowest wait times. But obviously things can always change, but there's ways to always kind of get a hold of us. And then last but not least, thanks. Thanks for having us out today. If you have questions, don't hesitate to reach out to myself or Amy or Alba. We can provide answers the best we can. And I'm going to stop sharing my screen now.
I'm just going to add, I don't know if I mentioned, but if anybody wants to be a community partner, especially those of you that work in facilities that house our homeless populations, if you're in shelters, if you're doing drop-in services, if you're doing outreach services, it's such a great way to stay in connection with people, to really make sure that we can keep people connected to their health care, their behavioral health resources, and all of those. So I won't say it again, but I will put my email in the chat and just encourage if anybody's interested, please reach out to me. But thanks for having us.
I just wondering, Shanika, if you could repeat the three exceptions that are going away. I just feel like that's going to be something that impacts our service providers clients the most. So just highlighting that again of what those
Yeah.
exceptions were and what the timeline on those going away. Is it immediately?
Yeah, they went away October 1st, and that's for veteran status, former foster care. So if there was any involvement in the individual's history or in the past with child welfare, or they were in the foster care system, they were exempt from those requirements. And then houseless and homelessness was also removed as an exemption.
Thank you. All right, any other questions before we move on to our other presenter today?
You have Amy and Alba's emails in the chat for those who need those. And Melissa, are you ready for your presentation?
Yep.
Here we
Okay.
go.
I'll stop sharing so that you can share. All right. Shoot. Give me just a moment. I'm doing this on a different computer and now it's okay. I don't think I'm going to be able to share. I'm actually on one of my work computers, so I will just talk you through what I have to say.
If
Sure.
you have a quick minute to email the presentation to Rosie or myself,
okay.
Then that will also work because we have a whole half hour here.
Okay.
To have you do your presentation. We do want to make sure that for the recording as well, that we can get as much of your content as possible.
Okay. Let me just send it right now.
And while you're doing that, I will just make a couple comments that I was sort of holding about the last presenters. ODHS, OHA, and I work for OHCS. Really comprise the three agencies here in the state of Oregon that support those of our neighbors that are experiencing homelessness the most. And so we do try to work together as much as possible to try to coordinate those services, expand those services, and sustain those services. All dependent upon the legislature to allocate money for those things. But the work that our colleagues do across the agencies at the state level really are important. And continuing to engage with them, even if you're not sure what we do, is always an important thing. So really value the work that Shanika and Amy and Alba all do at their respective agencies, and just highlighting that without the services provided by more than one agency and the federal government and the local organizations that all contribute to the services that are provided to our unhoused neighbors, we wouldn't have such a broad menu landscape of services. They're all needed. I think we kind of highlight that a lot around the behavioral health needs, the physical health needs, in addition to the housing focused services around getting folks back into housing, into services like shelter. Shelter is funded by usually 4 or 5 sources and not just one source, not just the state, certainly not just the federal government and grants provided by the federal government to build shelter. Those tend to be pretty rare. So it's the collaboration across agencies that I think really ends up providing the picture of services that you see here in Central Oregon. So we really value those things. that in part is one of the missions of the HLC, is to bring together these different agencies, public partners and private partners, in order to try to provide these services for folks here in our community. How are we doing, Rosie, on the presentation?
It's a new version, so I'm getting there.
Maybe you want to start, Melissa, by introducing your new organization and
Yeah.
what you do.
Excellent. My name's Melissa Blackett, and I'm the president of Central Oregon Homelessness Alliance, and I see several of my fellow board members on here. Lind, Chuck, Jenny is here somewhere. And then Barbara is actually at the family kitchen right now. I'm sure many of you recognize those names and their involvement in our community. A little bit about myself. I'm the board president of COHA. I'm on the Mountain View Community Development Board, and I work at Westside Church and Community Center as the Community Center Coordinator. I've lived in Central Oregon since 2002. And before that, I lived in New Zealand and in London. And in London, I worked with multiple community centers, teaching life skills and art to the long-term unemployed, homeless, and mentally ill. And also started with some friends a drop-in center for recovering alcoholics. Let's see, here we go. Thank you, Rosie. Appreciate that. Yeah, so I think we're on now to the next one. That's me. And then I wanted to just share some history of about COHA. We began last year, and actually the year before that, a group of us got together, amazing group of people, and wanted to put together a forum for educating our community and building empathy and just knowledge about the homelessness situation in our community. That was a great success. Many of you and your organizations were there. And so after the success of that event, we wanted to continue to have more of these forums, but also expand our reach and the things that we wanted to do. So you can probably go to the next slide, and then, yep, I'm introduced to everybody there. Our mission is to provide education to the community, advocacy and support for our homeless neighbors, and support to the agencies that serve them by strengthening community partnerships and providing a trusted clearinghouse for information and collaborative action. So basically, we have, I think that the next slide, you do not have to read all of this. This is for us to organize ourselves, but our main focuses are education. We want to continue to help inform our community, get rid of stereotypes and preconceived ideas, public engagement. We've got a great email and letter writing group who is always ready to spring into action to advocate for our homeless neighbors. We want to engage more faith-based organizations. And then a really exciting thing is the coordinated need response team that we're putting together called COHART. Good job on the name, Lind. So I will go into a bit more detail with that, what that means. On the next slide, the people really who benefit from what we want to do is our homeless population. They'll be helped by our community becoming more kind and understanding. Services coordinated will allow the service partners to, well, we're hoping to take some of that burden from them and coordinating, getting some resources out to people, and then obviously directly funds and resources for short-term needs that aren't normally provided by other service organizations. The next slide, how can we help? I really do want to highlight this team that we're putting together. The idea here is that we would be able to provide a response from local churches, local faith organizations, donations of items and services that are not necessarily covered by traditional service provider. Things like maybe it might be a set of tires or a refrigerator, a propane powered refrigerator to keep insulin in, very specific things that might not be covered by other organizations. And what the team that's putting this together is still working out the process. So keep this email address, and if you have needs as service providers that come up for things that might not be covered, we would love to help with that. Just be aware that we're still in the process of developing that process and what it's going to look like. We've got a good start, but we've literally, like this week, we've actually incorporated. So we're just kind of getting going here. And we will only we'll only be taking requests from service providers. This isn't something necessarily that just anybody can request. We want to be very wise and responsible stewards of the resources we have. So what's next? We wanted to let you know that we have scheduled the 2nd annual Central Oregon Homelessness Forum. It's going to be a similar time of year as last year, Tuesday, February 24th at Westside Church. And we're excited to do this again. We're going to have a slightly different focus, but we hope that everyone who was involved last year will be involved again this year. If you were not involved last year and are would like to be this year, we have booths, panelists, all of those things. Please let us know. If you were involved last year, you should have already gotten a save the date message. And if you didn't and you were involved last year, it means we have the wrong contact information for you. So please let us know. I wanted to show you in the next couple slides who was involved last year. It was an amazing group of people, and we're just so thankful for everybody who responded and came and shared their knowledge and passion. I won't list everybody, but it was a great lineup of people. So these were the people we had on our panel, Rick Russell from Mountain View, and next slide, Bainey, Tammy. They presented and emceed for us. We had Colton share his lived experience story. And then on the next slide is the list of community agencies that came out and had tables and booths or vans. It was just an amazing chance, not only for the community to learn more, but also for a lot of these organizations to actually be in one place at the same time and get to know each other and meet each other. A lot of people hadn't ever met in person, but had connected with these different organizations. So it was a really great event, and we're excited to be able to host another event next year. Again, if you want to be involved, please reach out to us. Our website is in the process of being updated. If you know of anybody who wants to do some free website development, we could use your help. But so our old website is still up. We're working on the new one, but this address points to the forum website from last year that we used. It's got a recording of the event last year. It's definitely worth a listen and a watch. And if you have any questions, you can email us, info@cohomelessnessalliance.org. The QR code there will take you to our website, and we're also on Instagram and Facebook. And we really are just here to help, to fill any gaps that are out there, and to be a support to all the organizations that are doing the difficult and hard work. And I am so grateful for my fellow board members. From the moment I've met all of them, they've just been an inspiration every day. So thanks for having us, and do reach out and let us know if you need any help, and let me know if you have any questions.
Thanks, Melissa. I am having some internet connectivity, so I will stay off camera. Any lingering questions for any of the presenters or about the board updates or anything else before we move to community updates? Okay, community updates is the time of our monthly HLC meetings when we invite our HLC members and guests who are working in the community, in the space, to share updates about their organizations, things that are going on. And that is that's where we are.
Or if anybody has new leadership you'd like to introduce to other service providers, or community announcements, events that are coming up, anything along those lines.
Yeah. I'll just toss in that this Thursday is our regional shelter committee meeting. We do have a regular committee meeting that occurs the second Thursday of every month at 10 o'clock. It's going to be by Zoom. Sometimes it's in person, but this month it's by Zoom. If you want to be included in that, I think, Rosie, would you be the person who could connect them? Yeah.
Yeah, all things HLC are just info@cohomeless.org, and that goes to the executive board members and myself, and so you get a response pretty quick, even on the weekends. John is on there responding to emails, so you usually get follow-up pretty quick. If anybody has any interest in joining any of the committees, you can check out all the committees on the website. And then also a point in time, that is definitely something that we are focused on right now and vamping up. I have community leads listed on the website, and then still looking for that Redmond superhero who wants to coordinate the Redmond Cats. So, let us know if you're interested in supporting Redmond service providers on coordinating their efforts for point in time. We really would love your support. Alex?
Yeah, I was asking, what is that event that he was just talking about on Zoom?
So it's a shelter committee. It's every month, and it's service providers that run all the different shelters in Central Oregon kind of get together and usually focus on talking about best practice. Sometimes there's, like if there's major rule changes or significant shifts for best practice, that's usually where it gets discussed. Sharing trainings and resources for shelters, stuff like that.
Okay, would that be good for the YAB to go to, or like I could go to it?
Well, we have the shelter, yeah, I would say John or Josie, if you would want to answer that.
Yeah, there we go. I would say anybody who's interested in how shelters operate in the region. I mean, we have some active members of the committee, Todd Rundall of Stepping Stones and Josie Mize of Oasis Village are the chairs, and they run the meeting, and different people will take on different roles, but I don't think we exclude people. I think if you just want to see what's being discussed, And you want to hear sometimes there's good education about best practices and challenges and upcoming events that can affect shelters. So it could be helpful for any service provider to tune in if they want to learn something about that.
It might even be good, like, for just having some background knowledge for the CQI too. Rosie, is it okay if I if you could pass me the information for that?
Yeah, totally. I can add you to the calendar invite.
Thank you. When is it?
I think it's 10 a.m., right, John?
Correct. Yeah. This
On
Thursday
Thursday?
at 10 o'clock.
Yeah.
Okay. Thank you.
And then just since we're talking about Thursday, that is when we have our strategic planning meeting. And we should get an update about where we're at. I do know we're going to be planning on hopefully doing some like focus groups in November. So November is kind of when we're going to try to get in there and get some focus groups done early November. And then yeah, so you'll hear from all of us soon.
Any other announcements? We really appreciate you attending, and we will see you next month.
Thanks, everyone.
Thank you, everyone.